Staff and staff of other people here. We have a senior manager from GURA, Kathy Titano, who I'd like to especially welcome and thank for all of her efforts on this issue for a majority of her career. And of course, Rob San Agustin, a program director in my office who is managing the council for us. I want to first thank everybody for their attendance. There is another member. She may be online, but I'll go ahead and announce that it is Dr. Margaret Hattori Uchima. She is Dean of the College of Nursing at the University of Guam. And I would say that I'm very grateful that she is part of the commission. Of course, she's worked with the Homeless Coalition, but on top of that, we are in a public health crisis. And right now, I would say that one of the driving issues and priorities is making sure that we shelter unsheltered individuals and protect them from the spread of COVID. I'd also like to introduce another observer participant, Jesse Garcia, the Deputy Director of Public Works and the Acting Director of Parks and Recreation, who has been instrumental in this regard. Before I get into the agenda, I also would like to express my gratitude and recognize Claudia Faji, the Chief Procurement Officer for General Services Agency, who has facilitated all of the procurements and contracts that are and will be entered into by the government of Guam. And I especially want to thank the Mayor's Council of Guam for being an active partner. And I'll just point out that for about a year, we've had an informal group meeting with Mr. Tapasnia, Mayor Hoffman, myself, and a few other individuals, trying to strategize and develop a good strategy to address homelessness. I would also like to thank the Office of Civil Defense, Mr. Charles Esteves. Go ahead. Mr. Charles Esteves for his work. He is the lead in establishing the non-congregate shelter at this time during this public health emergency, and of course the Homeland Security Advisor Tim Muggan for the early work trying to identify a very effective way to protect the health of these individuals. First item, prior to the agenda, I would also like to say that ground rules for me are, let's try and keep this meeting to an hour. I will ask the members of the council for their concurrence at this time, because this is a very complicated but a very important issue. I'm going to call this meeting weekly, Thursday at 11. And I would say that I'm looking forward to making some gradual progress and some and excellent decisions as we go down this path. First thing I'd like to do is point out, and all of you have a copy of Executive Order number 2020-03. And this is relative to reconstituting the Interagency Council for coordinating homelessness programs, establishing the Office of Homelessness Assistance and Poverty Prevention at the Mayor's Council of Guam, and providing shelter and protection for unsheltered homeless families and individuals. At this time, I would like to ask Stephanie Flores from the Guam State Clearinghouse to go ahead and walk the members of the council through the executive order, and in particular the mandates of the council, along with the mandates of the new Office of Housing and Homelessness and Poverty Prevention. So Stephanie.
Thank you, Lieutenant Governor, would you like me to go through? We can skip over the whereas clauses.
That's right. Go into the, and then what I'll do is I will take, if there are questions or comments from council members about any of the items, I will go ahead and I will entertain them. So Stephanie.
Okay, so we'll start out with paragraph number 1, the Governor's Interagency Council on Homelessness. So in Executive Order 2007-20 was reactivated with the charge of examining problems associated with homelessness and developing and implementing strategies and programs for a coordinated, effective response to reduce homelessness in Guam. Subsection A is Section 4 of Executive Order 2007-20. Now, everybody should have a copy of Executive Order 2007-20 in your packets. If you don't, we can provide those to you right after the meeting. And we reconstituted the membership of the Interagency Council so it is now 7 members, with the Lieutenant Governor, who is the chair, a mayor designated by the President of the Mayor's Council of Guam as the vice chair, Executive Director of Guam Housing and Urban Renewal Authority, the President of Guam Housing Corporation, the Executive Manager of Guam Regional Transit Authority, a member of the general public as appointed by the Governor, an employee or volunteer of a member organization of the Guam Homeless Coalition appointed by the Governor. And we would note, Lieutenant Governor, that all of these 7 individuals are here and present for today's meeting. In addition to the duties and responsibilities of the council established by the previous executive order, the Interagency Council shall put their efforts to pursue the following new issues. Establish an integrated case management program to identify, coordinate, and assist homeless individuals and families with services, emergency shelter, and housing. Such case management program should be available to government authorities and human service providers, including volunteer and faith-based organizations. Number 2, identify and seek to remedy gaps in services. Number 3, promote and support the development of immediate, transitional, and permanent housing for people with disabilities, the re-entry population, veterans, distressed families, youth aging out of foster care, and the unsheltered population. Number 4, propose and advocate for policy changes and government services to advance the cause of reducing homelessness. 5, support the Office of Homelessness Assistance and Poverty Prevention. Engage the Judiciary of Guam Probation Services Division Reentry Court to develop strategies for justice-involved individuals who are homeless or at risk for homelessness. And number 7, address the needs of homeless foreign nationals with the Consular Corps or other government representatives, including the repatriation of stranded foreign nationals to their countries or islands of origins. Are there any questions so far on these new mandates? Number 2, the Office of Homeless Assistance and Poverty Prevention. There's hereby created the Office of Homelessness Assistance and Poverty Prevention, or OHAP, within the executive branch and under the administrative supervision of the Mayor's Council of Guam. The OHAP shall be the lead government of Guam coordinating agency on homeless assistance and poverty prevention, and shall work in close coordination with the Interagency Council. The OHAP may obtain, receive, and administer grants to support its mission and operations. The OHAP may employ such personnel as may be necessary to carry out its functions. The OHAP is authorized to establish a work program for its clients, which may include the provisions of stipends for such programs participants. The OHAP shall serve as a referral agency and departments and agencies mandated to provide housing, public assistance, human services, healthcare, social services, education, public transportation, behavioral health, employment, workforce development, substance abuse, parole services, child protection services, adult protective services, disability services, jail and prison reentry, emergency preparedness and response, and public safety services shall cooperate and assist the OHAP with its mission to stabilize and assist homeless individuals and families. Departments and agencies may physically and administratively assign personnel to assist the OHAP on a permanent, temporary, or rotational basis, including but not limited to eligibility specialists, caseworkers, social workers, and housing staff. Original documentation to establish proof of residency required to obtain a Guam identification card for homeless individuals and unaccompanied homeless youth pursuant to Public Law 35-32 and Section 57107 of Chapter 57 of Title 10 Guam Code annotated from the Department of Revenue and Taxation may be issued by the OHAP. The OHAP shall establish a family reunification program to identify family members both on Guam and abroad for reunification of the homeless population with their families, to coordinate the transfer of services and to facilitate travel, if necessary, for the purposes of obtaining medical care not available in Guam or for humanitarian purposes. The Department of Public Health and Social Services shall prioritize and consider applications and requests made by the OHAP for individuals seeking eligibility to receive mileage for off-island medical care pursuant to Section 2311E of Chapter 23 of Title 5 Guam Code annotated. And F, the Office of Veterans Affairs of the Government of Guam shall actively identify and engage homeless veterans for the purpose of securing housing and public assistance benefits, including homeless veterans housing vouchers. Such efforts shall be coordinated by the OHAP and GURA. And the third mission is the shelter and protection of unsheltered homeless individuals and their families. The Government of Guam, in coordination with the Department of Public Health and Social Services as the Public Health Authority, shall work to make shelter and protection from COVID-19 available for unsheltered homeless individuals and families for the duration of the public health emergency. The Government of Guam, through the work of the Interagency Council and OHAP, shall endeavor to establish a shelter, transitional housing, and paths for permanent housing for homeless individuals and families once the current public health emergency has concluded.
Thank you, Stephanie. Are there any questions or comments so far regarding any of the provisions that are included in the executive order? All right, I will pass the mic to First Lady Joanne Camacho.
Section B, number 7.
Mm-hmm.
It should also include states because it says national countries. States, I mean, because we probably sometimes.
Absolutely. So that's a good suggestion, and based on the authority that has been given to me as chair, we can add that to the focus of our program here, and so that will be added. Thank you for pointing that out. Any other questions, comments, Mr. Tapasnia?
On the last page, item 3B, the Government of Guam, through the work of the Interagency Council and OHAP, shall endeavor to establish a shelter, transitional housing, and paths for permanent housing for homeless individuals and families once the current public health emergency has concluded. We don't know how long the emergency will last. If, say, it goes on for a year, we'd like to do some of this even prior to, so I don't know.
Sure. Yeah, so I agree with you. The planning for the permanent shelter options and for sure the transitional housing, we can work on that concurrently and immediately. So I agree with you. Okay, we will do that. Ms. Tyherin.
Just a question, Lieutenant Governor, appreciate it. I don't know if this is an issue for homelessness. Anchor babies, pregnant mothers coming in and giving birth and potentially becoming homeless with that child. So I don't know if that's a situation.
Actually, it is a situation. I know that in the public health side, we've had a situation where foreign nationals have come in, gave birth. Unfortunately, there's been an illness with the child. Child was entitled as a Guam resident to receive indigent medical services, but the parents were restricted from traveling and did not have a visa. So there are issues that compel us to look at that, and I would say that it certainly is within the mission of our group. But thank you for pointing that out. Any other questions or comments? If not, I would like also to go back to Stephanie. This interagency council was actually established by former Governor Felix Camacho in 2007. And so what I'd like to do now is in your packets, review the executive order from 2007. Stephanie, I think that you can go into and focus on the functions of the executive order. And then we will, Crystal, we will take questions from the public during the open discussion. Okay. So Stephanie, why don't we focus on the functions and the activities, and then my intention here, I wanted to review that, but I'm going to assign somebody to review there are some of these things that have been resolved or have been completed. In particular, the Homeless Coalition has taken the leadership to take care of certain of these items. But I would like to identify those items that continue so that we understand that continues to be the focus of this council. So Stephanie?
Yes, thank you. The Guam Interagency Council for Coordinating Homelessness Programs was established in 2007-20. The functions of the council shall include replicate the functions of the U.S. Interagency Council in all areas that can be carried out at the Government of Guam level, report to the governor on progress in creating and implementing strategy, serve as the single Government of Guam homelessness planning and policy development resource, develop a Guam 10-year plan to end homelessness with emphasis on eliminating chronic homelessness, articulate an implementation strategy for a successful 10-year plan, recommend policy, regulatory, and resource changes needed to accomplish the objective, and G is ensure accountability and results in implementation strategies. And then the activities of the council is the Guam, letter A is the Guam statewide plan. Is to develop short and long-term strategies and plans to end homelessness with an emphasis on eliminating chronic homelessness within the next 10 years. Ensure the use of baselines and benchmarks in Guam's plan with an emphasis on performance and outcomes and a concrete strategy for oversight and monitoring of progress. Partner with the cities and counties which have developed 10-year plans to end homelessness in order to identify resources and common strategies. 4, seek to coordinate the activities of statewide continuums of care. 5, assemble accurate fiscal and demographic information, including cost-benefit analysis, research data to support policy development and track outcomes. B is to establish priorities or action steps based on the planning, including number 1, recommend interagency strategies, for example, funding, homelessness prevention, and discharge planning. 2, review all Guam activities and programs assisting homeless persons. 3, support and replace collaborative Guam homelessness initiatives that demonstrate measurable outcomes. 4, promote system integration, parentheses, health, service, housing, close parentheses, to reduce duplication among homelessness assistance programs. Identifying funding opportunities, including mainstream resources for homeless persons. 6, involve non-traditional stakeholders, including representatives from corporations, businesses, philanthropy, law enforcement, behavioral health systems, hospitals, civic organizations, faith-based organizations, or other community institutions. 7, recommend statutory and regulatory changes to enhance strategies. 8, bring problems and concerns relating to the homeless people to the attention of appropriate state agencies. C, promotion of the plan and evaluation of progress. Number 1 is report to the governor. 2, provide an annual progress report on the plan. 3, educate the public. 4, disseminate information, data, and best practices to educate state officials and the public regarding issues related to homelessness. 5, host an annual homelessness conference. Section 4 is membership of the council, which I believe we have reconstituted, so it's not necessary to go over that group there.
Right, right. That's about it.
That's
All
it.
right. Well, thank you, Stephanie. Any comments or questions from council members regarding the mandates of Executive Order 2007-20, which still remain, by the way, since they've not been repealed. And as you know, the council that was created by Governor Camacho is reconstituted. Mayor Hoffman?
Thank you. I have just a quick question. I know most of us weren't at the table. Do we know where they were able to actually get some accomplished done? Kat, were you a part of during this part here, the interagency? So no, there wasn't. I just wanted to see if there was some things we could actually reference on maybe the do's and don'ts or things they struggled with that we don't have to reinvent. So thank you. We'll probably look for that.
What we'll do is we'll have Rob and our clearinghouse staff identify all of and try and locate the reports and recommendations that were submitted at the time. I can tell you though that this executive order pretty much laid the foundation and framework in which the civic society came together for the Homeless Coalition. And so maybe what I'd like to do, if that's okay with Dr. Uchima, maybe I'd like her to comment on that. There has been a tremendous amount of work in progress that has been done by the Homeless Coalition, which we appreciate. And this effort, by the way, is to step up and coordinate the government's response and partnership with the nonprofit sector. So I'll pass it on to Dr. Uchima.
Thank you. And I apologize for being late. And really, this is has been a great, this is wonderful because the Homeless Coalition, and Ray knows from Gora's end, has been advocating for reconstituting the council. So this is perfect timing, and we really appreciate it. Before I forget though, there was one thing, I think this 2007 list of priorities is excellent, but under number 6 where it says involve non-traditional stakeholders, one thing that we have kind of missed, I know it says hospitals, but within the coalition, we have found a huge gap. And I think you've seen it too from your work recently with housing those families and meeting the chronic homeless, is that there's a huge gap in terms of healthcare. We've been trying to work with GMH and GRMC, but they both struggle. They both have clients that are there long-term because they have nowhere to send them, right? And of course, the mayors have seen those with chronic illness that are still in the community. So I know it's listed there under hospitals, but for some reason, we just have not been able to make much progress in the way of health. So I appreciate being included on the, yeah, we suspected that. But I will say, and former First Lady's been really instrumental, before with the Homeless Coalition. It has come a long way. We do have a lot of the NGOs involved, and a lot of collaboration. But I think one of the difficulties, of course, is Gora's aware of this, is although you may have funding for some of these housing programs, sometimes it's hard to find people that are willing to let the homeless live in their houses or apartments. That seems to be a big issue. We've been working a lot with Department of Labor on programs for job training. So that's been I think an area where we've made a lot of headway, but we need to continue. During the last point in time count, we did have a very strong person from Department of Labor. And for example, we found a group of individuals that were new to us. They were hiding in an area in Tumuning, Upper Tumon. And we were able to that day get them scheduled for Department of Labor's job training at the, that was not the one stop, what's it called? American Job Center. Yeah, so with Department of Labor and the AJC, I think that's been a key in trying to get some people back on their feet with a job, right? Of course, with the pandemic, I mean, we all know that's really, really a big issue. But in terms of behavioral health as well, that seems to be another key area where we haven't quite improved enough. Partly it's because of the limitations with staffing, and also, we don't have a lot of teams that will do outreach. I mean, even prior to the pandemic, right? You've been with CSS on their outreach, but we don't have teams in all the GovGuam agencies that are manned well enough to actually do outreach. So in some situations with Guam Behavioral Health, they're willing to help, but we have to bring the client to the facility. And with some of these people that have been homeless for a long time, even decades, they may need medication and counseling, but to drag them to Guam Behavioral has been just so difficult. They refuse. And we have driven some, and then they won't get out of the door. But there are limitations with the current structure, what we have. But yes, you're correct. A lot of these issues, there has been a lot of, I think, forward action with the different members of the coalition. But adding the mayor's council, I think, is genius because,
They know who,
yes,
they know who in their villages
right.
are homeless. And so
And that may have been the missing link, right, with the coalition, is that, and we always reach out to for outreach and things like that, but having this formalized, I think is genius, and I think it's gonna.
Was one of the things that we talked about as our colleagues is we're constantly asked to certify they're homeless on a
Right.
verification system that we're like, but we don't know, where you're originally from. So it became the barrier for them getting IDs, which became the barrier for them getting employment or other benefits. So we realized we do play a role in this. We know and we recognize there are homeless families, there are people at the brink of getting homeless. And we're trying everything we can in our ends as local leaders. So we appreciate the administration and everyone here's willingness to kind of step up to help us deliver that service. So we're excited about having the office, and we're already getting calls. We're slowly kind of stand that up on that end, but just the fact that we're able to make adjustments and work together and do that. So we're going to complement what the Homeless Coalition's doing. There's going to be the ability to help, each other in terms of receiving donations for that we can get it from your coalition to the agency itself to down to the mayors there. So a lot of the labor issues might get solved there, and resources that we can go and pick up some supplies and make those call outs for beddings or things. And so we constantly get it, even with fire victims, emergency, those are the things we're having to deal with. So we appreciate your work. Thank you.
Thanks. Sorry, I don't know if I answered your question.
Yeah, no, you're fine, Margaret. And what I wanted to say is that I have visited actually a long-term patient at GMH who has been there for 2 years that doesn't have access to ground floor accommodation and assistance. And it would just seem on the big picture, right? Paying for step down is dramatically less costly than keeping him at the hospital where he really would want to recover in a better environment. And those are the casework issues I think that we'll be getting into. And Margaret, you did point out it has been that was one of the drivers in asking you to take the seat, is because of this disparity and lack of access for healthcare. I'm hopeful that the other thing is with the Guam ID, or the ID program that Senator Mary Torres authored, that we be able to help get determine and obtain qualifications for at least the local funded programs as we get their original documents and establish or reconfirm their identities and get them on a path to see whether or not they can get in some of the federal programs. So I think that that's certainly part of the program. The other thing I want to say is that in the next few weeks, I will be asking government agencies to make short presentations about the scope and the work that their agency has with each of the populations. And in particular, I received a forward from behavioral health, where already they have social workers that are focused on children at risk of homelessness, 5 to 18, and agreeing to assign social workers to the office on twice a week, perhaps, to try and get things done. So we'll kind of talk about that also in the next section of the agenda. Any other discussion on Executive Order 2007-20? Ray Tapasnia.
Yes, if I can just suggest that we add an additional function. There is a U.S. Interagency Council on Homelessness. maybe Gura can take the lead and, you know, identify whether there's resources that we can tap at the national level and how we can best interact with the U.S. Interagency Council. So if I can just suggest we include, I don't know whether that's in there. I didn't see it, but.
Yes, in fact, I think it is covered in 2007-20, which is in sort of a way, but yes, we would go ahead and I certainly appreciate leadership on that front. Ray, I understand also, of course, that right now there is a funding stream, not necessarily a huge pot, but a funding stream that gets pushed through to some of the nonprofits that are already sheltering some of the target populations or providing sustenance in the way of food and food banks. And although we'll have Gura maybe present in the next meeting, could you just take a little time to discuss the current efforts of Gura? And I will, of course, recognize your staff of Morse, who has been one of the people in the government that has been really taking a lot of leadership in this regard. Ray?
Thank you, Lieutenant Governor. I don't want to say too much because we currently have our grant proposals in with HUD for final approval, and we hope to get that approved hopefully within the next. We anticipated getting approval this week. I think it's pushed back another few days, so possibly sometime next week. But yes, you're absolutely correct. We do have a couple of projects that are in the works. I don't want to identify who the nonprofits are or the NGOs, but primarily to assist with our efforts. Hopefully get us to the point where we can provide for transitional housing for some of the families that we'll be talking about later on with respect to OHAP and its work to get some of the unsheltered families into the emergency shelters. So yes, I'll have more to speak on that once we get HUD approval, but there are, based on the COVID-19 funding that we received, we are just waiting for HUD's final approval on some of these projects, and we'll be unveiling them shortly.
Okay, very good. And so, Ray, what I do is, since you have been, your agency has been one of the leads in coordinating the Homeless Coalition, we'll get you to be on the agenda next week. And then maybe we can bring more. Kathy's here, but you could also maybe talk about in the recent years what the funding streams have been and for what areas. And as an example, you know, this is the same funding stream that is stabilizing or enabling Guam, for example, to continue their shelter along with some of the others. So we'll go ahead and put that on the agenda next time.
Okay.
All right. If there are not any other discussion in with regards to Executive Order 2007-20, I will move now to the Office of Homelessness Assistance and Poverty Prevention. This office, as you know, has been created at the Mayor's Council. The office will be funded by federal funds identified by the governor from the Department of Interior. And there is a active review and transfer for their operating expenses. That still is pending, but I'd like to now call on Mayor Hoffman.
Sure, thank you. I don't know if Angel Sablan is on Zoom. I think I saw his up earlier on that end, but we are actively looking for office space. We're shoring up the personnel to include a program coordinator. We're currently taking in resumes for that from experienced people who've been a part of the homeless scene in that end. Also, we're looking for meeting spaces as well, because we know that some of the things are going to be either interview rooms and stuff. So we're really trying to do this where we're helping them in a way and providing the dignity and privacy that they need versus it being an open area. So we're really getting in the recommendations of how to properly move forward, as well as the procurement of the management information systems, as well as the ID machines to create the IDs. The IDs hopefully will be able allow them to get the benefits that they need in a way that they are indicated as a person that is currently in the system, We're also working to review the point in time count information, so we actually get an accurate count of all the information that is there, and then connect them to the correct services on that end. But we are excited. We are just waiting for the funding. I know that's a discussion that the governor has had with Mayor Savaras yesterday, actually, and I know it's in the pipes as well. And then we're working. We're going to be working with the administration to address the stipend program.
Right, and maybe what I'll do is I'll just point out that in the item 2A, in the last sentence, it says the OHAP is authorized to establish a work program for its clients, which may include the provision of stipends for such programs participants. And so we will lean on the council to work with the mayor's council on developing an effective program, which I would think could be an incentive, help stabilize families and such. First Lady Joanne.
Mr. Mayor, I know you have time to get started, but we have to have something in our books, in our records that tell us right now where the homeless are or who they are, some kind of indication. So we have some kind of baseline.
Yes, there is. The point in time count is like a 4-page interview sheet that has their information of their situation. That's the information is all there, and it's getting access to it. And what we need to do as an OHAP office is work with a memorandum with all the specific agencies for the information sharing, because sometimes agencies are very critical about, I can't tell you, or who are you just because you work at OHAP. So we want to establish these MOUs with these agencies so they allow us to have that information sharing both ways, where they're not going to be able to say, I can't talk to you as the worker at the office, I have to talk to the individual, but we want to be able to be that advocate for that person. So by working with the MOUs with the agencies like public health, like GURA itself, that we can have this discussion. So we don't feel that, we have to really step up our game in this end. We don't just want to be an agency itself, but we want to be the advocates for it as well and have access to their information. So we're going to have access to the point in time count information, and then access to their information for the services they're receiving, so we can find out these gaps.
But at least for the point of time count, I'll ask Ray Tapasnia, who actually is the entity that the count is reported to include that as part of the presentation. And actually, Ray, maybe you'll also, I know you're pretty good at Excel, I'm sure you could give us, since the point in time count has started through each of the years, you can kind of give us a big picture view on what has been going on over the last 10 years, and what target populations there may be problems, but really we're looking at more at-risk populations that are coming on.
And
First Lady?
On top of that, maybe Ray also, because I worked closely with more in the past. I did ask, of all the grant or whatever agencies that handle homelessness, there's got to be an org chart with what each one of them do, and what's their capacity, what's their funding source, and who's their leader, who's managing them, so that it's easy as we identify things, how to send people different. I I did get a list, but I kind of think it'd be to know that, because if funding's running out, we have to find out what we're going to do next, right? And how to direct these people.
Okay, I'll pass on to Dr. Uchima.
Sorry. So I know Kat's here with Gura, but yeah, Gura has all that info, and Amor and Kathy have all the info on who's in charge, how much has been expended, how much, what's allocated to them for their programs. I have the 2018, which is the most recent. I'll leave that with you, but I know the electronic is actually on the website, but the preliminary for 2019, we had to wait for HUD to approve it. Yeah, we have to submit to HUD. So that's the only reason 2019 hasn't been published, but we are finalizing that. But I'll give you the 2018. But the only thing, and I'm sorry, maybe I should bring it up here, is there is a homeless management information system. And so I'm so glad you brought that up, because I know that has been so helpful to the providers. And even myself, not as a provider, I've had to call Amor and try to find out a particular homeless person. And she can just access the homeless management information system, and it will tell us which provider they've been with. For instance, how long they were at a particular shelter, then did they go to a different service provider? And that's been one thing that Gura has been great about over the years. Yeah, that's really been an improvement over the years to be able to have access to that data. So I was so happy you mentioned management information.
Yes, so that's one of the things that we had the discussion with, and also the governor and the lieutenant governor have committed to get those people in those agencies that are tasked with doing things with poverty prevention, homelessness, to work with us either by detail. So you saw that mental health's willing to, behavioral health's willing to detail people. Also having Amor there and a few other people from public health and whatever agency, because there are agencies tasked with some sort of mandate here and there. Sometimes it's just a little bit, but it's to find out and kind of connect the dots there. So we're really excited about that.
So I think I know that my office had been developing an inventory. I know that the Homeless Coalition has some resources, but at least on the government side, because there also is a knowledge gap, or at least sometimes we're not necessarily labeling things that they are part of the framework. So it is in our interest, for example, for Alley Shelter to be very strong and to be whole so they can continue the shelter mandate for women and children who are at risk for homelessness because of the domestic situation. So I think Guam State Clearinghouse and my office will start the inventory informed by the Homeless Coalition as well, and then from GURA. And then we will keep that as a continuing resource that we'll put up. And as we develop the online presence for the Office of Homelessness Assistance and at large, we'll be happy to publish all of those resources. All right, next item is the shelter mandate. And what I would like to do is point to items 3A and 3B. Ray Tapasnia from GURA pointed out that these things are, the work in these things and the goals that are included should be happening concurrently. So of course, item 3A is a mandate that is currently being executed, and that is providing non-congregate shelter for unsheltered folks. And I do want to maybe just take this time to explain that originally, based on the pre-COVID models, congregate shelters are developed because of the ease of coordinating the delivery of services and goods to homeless individuals. But with the social distancing mandate and the risk of the community transmission, we probably reimagining how we offer services in a congregate setting is going to be a big, I guess, question that we need to resolve. Because the pandemic is, we're in the midst of it. There's a rise in the U.S. It doesn't seem that we're going to be in the clear anytime soon. Fortunately, we're doing well on our island with our numbers. But so there is a mandate. We're working with civil defense and public health, and we'll kind of brief everybody on the. And actually, this is a good time. Let me just give you an update on where we are with this first of the shelter facilities. So I want to say that this is the first because the demand is greater than at least we know for this first shelter. So before let me just also thank Catholic Social Services for providing the case management services, and in particular, Paula Perez, who is a big change agent and advocate in this area for being our partner on this and coordinating for them. But currently there are 50 individuals that are in the shelter, and they are occupying 39 rooms. There are currently individuals that are being reviewed or screened. And General Services Agency is identifying other options that are going to be appropriate for all the different kinds of populations that we're seeing. And so next week at our meeting, I would expect to report that we're going to have already added additional capacity to meet the demand. And the commitment is to try and provide shelter to all the unsheltered individuals. And then, of course, the bigger long-term work that we have is in item 3B. And this is on top of this emergency shelter for the public health risk. We do need to have establish and expand a permanent emergency shelter program and facility. And we also need to add other assets going down the system to try and track the progress that we believe we can make with the homeless individuals and the families. So a big area is transitional housing, and in particular with Guam Housing Corporation and GURA, this is something that I'm going to task the two agencies to work with some options. There is going to, next week, I believe we'll be able to announce a private sector foundation that is stepped up to purchase and donate, let's see, right, housing units that for us to place on government property. And so Jess Garcia has been working on that with land management. There are some ideas. The key thing here with all of the shelter options and transitional homes is dealing with transportation. So transportation has been a barrier. In many cases, it has limited the areas that we can go to. And but you know, folks that are trying to stabilize their lives, if we're going to try and push them into some skills in education or therapy, for that matter, they need to be accessible. And also for health. So looking at assets that are close to the public health centers, that are close to transit points, access to groceries, things like that. Those are some of the overlays that we want to look at. And then on transitional housing, in my meeting with Catholic Social Services, you know, an example I would give is at Alley Shelter, where there is I know there is a mother and with children there that really should be in transitional housing, but because there's the lack of, they're still in the shelter, which is meant to stabilize individuals as part of their programming. And these are, of course, victims of or in danger of domestic violence at the household. So the transitional housing piece, I think, is going to be a very big, significant piece. I've been talking to Ray about blending funding opportunities to try and come up with a good strategy to try and get some transitional homes online. I know the governor and I have did a tour of some of the GURA and Guam Housing Corporation assets. I know Guam Housing Corporation has some assets that need repair, and I think we can. One option might be finding some funds to maybe purchase or lease those assets from the corporation. And those are some of the things. So there is we're able to respond immediately to the current shelter. And once everybody's there, we're working with the casework. We'll be able to really understand the demand and be informed by the Homeless Coalition. So there are 50 individuals. I'll just say that out of the 50 individuals, there are several children that are up there. In terms of the demographics of the population, I got older, so I need to wear glasses. 36 of the 50 are of Chamorro descent. 8 are of Chuukese descent. 2 Caucasian, 1 Filipino, 1 Hawaiian, 1 Palau, and 1 Japanese. So as you can see in this first round, many people think that this is a problem being experienced by people that are not from here. And this data will show you that predominantly these are people that have been born on Guam that are now in this in the situation of homelessness. All right.
It's got to certainly be transitional, because if it's not transitional, people are going to want to get on it to, you know, to.
So the screening
get a free ride.
and casework and the priority there are, and of course, there is different categories of homelessness. There are people that are unsheltered, and this mandate for the COVID emergency is specifically focused on unsheltered people that have been living in parks and areas. There are other groups, a larger number of people that are living in substandard housing, predominantly in the south and the north, in Chamorro Land Trust areas. And we will one of the things that probably I will lend the big picture thinking of Ray and Alice. I'm of the opinion that we should move the Chamorro Land Trust ones into an area where we can find some affordable structures that are safe, and I'm hopeful we can find paths for the Chamorro Land Trust Commission to be helpful with identifying funding opportunities for families to perhaps purchase some very, very affordable housing options that are safer than what they're dealing with today. And that is also yet another long-term need. Yes, right. Right. So you're referring, of course, to the LADA development, the dollar homes that are across Estumbo Elementary School. And one of the things that Ray and I learned when we're meeting with the HUD folks and the Hawaii state government folks, a lot of the, as we step down, it's very important to have on-site shelter managers or housing coordinators to make sure that the properties remain safe, especially for children.
And they're
But
maintaining.
that's right, to maintain and also to make sure that we continue or coordinate provision of services, because it's sometimes people have been placed and then they feel that the issues resolved when some of the underlying issues that are causing the homelessness are not being addressed, and it will just become a cycle. So that certainly, it's very complicated, but that's kind of like the direction that we need to go on. Any other questions on the shelter mandate? Committee assignments and focus areas, I just wanted to put in there that I'd like all the council members to take a look at the executive order. Maybe I would like to take some recommendations for a committee structure or a lead structure. In the committee structure, I would encourage chair to be a council member, and members of your committee can be members of the general public or key figures in government agencies that would be basically operating as working groups to help the council member who would be a lead. So in the big picture, we can start very simple. However it is, take a look at it. If there's an area in particular that a council member believes that they're going to be able to drive some change and progress, then I would welcome the council member to make that known so we could get that done. It's always great to have members that are either subject matter experts or have advocacies or passions for things to get things moving. And then item E, agency presentation. So what we'll do is we'll start, Rob and Gura will be the first agency that will present next week. And given the communication that I received from behavioral health, we'll add them on also for brief presentations. Actually, you know what? Because Gura, I think, has maybe a lot to discuss, and our meeting rule is 1 hour. I'll be happy to focus on Gura, and then the meeting following will be behavioral health and perhaps public health. All right. I have now dispensed with the items. We are now in open discussion. Prior to us, I will also, I know that there are some questions that some of the viewers have submitted to Crystal, and so we'll go ahead and address those. But prior to do that, Mr. Babalta.
Lieutenant Governor, thank you for bringing up the issue with transportation. I'd like you to know that my staff and I have been proactive in this regard. We've already started planning on what it's going to take to support our population of Guam in terms of transportation, because we realize the fact that, many of our people are unemployed. Some of them are going to be looking for jobs. Some of them don't have transportation. So in addition to homelessness, we've been also looking at those people who are needing transportation to take advantage of some social programs. So we do have federal funds, because a big challenge that GRA has right now is the number of vehicles that we have. We have adequate number of vehicles to support our fixed route and our paratransit transportation systems. But on the other hand, we really need more transport vehicles to transport, especially the folks with homelessness and so forth. We do have federal funding, so I'm going to be working very closely with GSA to go out and procure the buses and vans that we need to make sure that we support our people with regards to transportation. So we started the planning, and I will be identifying the resources that we need. But most importantly, the big challenge that we have is buses and vans.
Okay, thank you, Sal, for all the work. Crystal, we're in item, do we have any questions that haven't already been answered over the course of our meeting? Okay, Alex.
Yes, I actually had a few questions that I wanted to ask, but some of them had been answered. Now, the
Alex,
one
before you start, could you identify yourself just for our
yes,
notes?
Yes, my name is Alex Ronyang, and I'm a freelance writer for Pacific Island Times.
Okay, all right.
And the one question that I haven't had answered is if I could just have the names and offices of the individual members of the council, please.
The consulate offices, our communications office will give you that list. Okay,
thank you. But the other question I had too is related to item 3A, but you have already addressed that, so thank you so much.
All right, Alex. Are there any other questions? Janica. Go ahead, Alex. Did you have anything else?
Right. You alluded to earlier about the coalition, the housing coalition from Gura. Is that part of this council now, or is it a separate entity? So I understand that the director is sitting on your council, but
sure. So the Homeless Coalition is a partner, and there is a member of the Homeless Coalition that is on the council, and that is Dr. Uchima. The council president is Angelina Lepe from the Department of Education, and Amor Say from Gura is the lead Gura official that has been coordinating with the council and is part of that. But I would tell you that we will, throughout the course of our work, you will be hearing quite a lot about partnerships and collaboration and information and guidance from the Homeless Coalition. All right, next is Janica. Hi, Janica. What, could you go ahead and identify yourself for the group?
Yes, my name is Janica.
One more time, Janica, could you repeat yourself? We lost you.
Janica Guam Memorial Hospital.
Oh, from GMH.
Can you hear me?
Janica, I think maybe it might be your microphone.
You hear me?
Yeah, there you go.
Okay, I had to take you off my earpiece. I'm sorry. So I'm not quite sure this is the forum that I can bring these issues up to, but Guam Memorial has a different population of homelessness here. And the challenges that we face at Guam Memorial are patients who are abandoned by families and left here in our hospital. And these patients are either bedbound, they're persons with disabilities that need some kind of durable medical equipment to be independent post-discharge. We have patients that need wound care and physical therapy post-discharge and outpatient services. And last but not least, we have elderly individuals who are also abandoned here. And we are struggling with sheltering these individuals because, number one, they are now homeless. Families are not being able to be contacted, located, And even if we begin dealing with families in the beginning, I tell you, Lieutenant Governor, we lose them. They no longer want the responsibility and they no longer want this. So that is our biggest challenge here, in addition to our independent homeless individuals that come into our ER every day, every other day, or every week, and they come for a shower, they come to eat, they come for respite. And these individuals we are trying to capture in our hospital, and we're all trying to work together to help them to obtain insurance, to obtain some kind of benefit, public benefit, to help them feed themselves outside of the hospital. But when we are dealing with these patients, we are coming into these challenges where they're coming back over and over, and eventually whatever was disabling them in the community is now become worsened. And so we don't know what to do anymore with trying to even get them housing, because then now these individuals need caregivers. And so again, I'm not quite sure if this is the forum that we have to bring this up to, but if I may suggest trying to train independent homeless individuals to become caregivers and pair them up with our patients, I mean, I think that would be something we could look into. They could get shelter at the same time, gain some kind of work experience in the field. But that is something that if the council could please consider assisting us here at Guam Memorial with these particular.
Yes, so Janica, this is the right place. Sometimes some of the cases, the public guardian gets involved to establish guardianship with the courts when the families abandon or are unable to care, or in some cases are taking advantage or abusing these family members. So what I see is, I think that's an excellent idea about training caregivers. In fact, GCC has launched a training program that is going to be focused on folks that are not medically trained, but can be caregivers, either as a profession or folks that have been designated or willing within their families to do that. So our main partner will be over at the Office of Housing Assistance, Homelessness Assistance, that the mayor is, but this will be a pending issue here. And in fact, as you were talking, I was, Dr. Ochima and I were looking at each other because that is a gap that we have talked about previously. And actually, I have visited one of the individuals that's been up there for, I think, 2 or 3 years. Maria Perez brought me to him, and he's been on my mind so the need is a step-down facility or an option for them, which really is going to help GMH preserve the bed capacity for those that really need hospitalization, but provide a step-down program from the hospital. So thank you for bringing that up, Janica. And Janica, what is your last name? We didn't catch it.
Absolutely. Absolutely. Thank you so much. My last name is Quintaniza.
All right. Thank you, Janica.
I have a question.
Thank you.
Yes, Janica, First Lady Joanne Camacho has a question.
I'm just taken back to know about the situation. But Janica, if you can be more specific as far as numbers, or you obviously can't give names, but numbers, so we know the magnitude of the problem that GMH is facing, so it can be properly addressed. That
So
would
maybe
help.
what we'll do, Janica, is I'm going to ask Margaret, who is working collaboratively with hospital leadership, and I'm going to ask her, maybe she can get the data. Do you have anything to add?
I know Janica. She's a great social worker. And yes, we've communicated with GMH before on the Homeless Coalition, and we always let them know when we're doing the point in time count. But that's always so difficult because sometimes we'll run over there and they're already gone. But Janica, so I'll call you and we'll work on getting the data. Yeah.
That's wonderful. Thank you guys so much.
But I'll talk to GRMC as well, because I've talked to them and they have similar, not as much as you, but they also do have similar situations. Okay.
Yes,
All right.
thank you. I think our biggest worry, Lieutenant, really is where these patients where would they actually go, right? Where would they live, and who would care for them? Thank you.
Thank you. Adriana, is that for Adriana from KOAM?
Yes. Hi, Lieutenant Governor. Adriana Cotero with KUAM.
Hi.
Sorry, I had tuned in near the end, so I don't know if this was addressed, but I just wanted to know where funding is going to be coming from for the office and the committee, and if you could tell us how much is being allocated. I believe in a conversation with you personally, Lieutenant Governor, you had told me that it will have its own budget.
Yes. So the governor has identified funds from the Department of Interior that we're going to be assigning to the Mayor's Council for the Office of Homelessness Assistance and Poverty Prevention. The governor has allocated $1.5 million for a multi-year funding stream. I would say about maybe less than, maybe about a third would be for an operation and the employment of coordinators, eligibility specialists, home attendants, things like that. But the bulk of that is meant to fund a stipend program that is part of our mandate. And we'll be developing a work/stipend program that is meant to stabilize homelessness individuals that are able to work or do community projects, and provide some financial assistance as part of that program. So that's it. Anything else, Adriana?
Yeah, just one other question. Again, if it was addressed, forgive me, but I'm just wondering, whenever, I know you mentioned that you guys have, is it about, I think I heard about 50 families that are there right now in their house. Are there any plans to open it up as almost like a come and go as you need shelter?
So kind of bed for the night is a facility and a program strategy that we intend to pursue as well. That's part of the plan. We just have to make sure that the operations of such a facility are going to be consistent with the public health situation that we're looking at. So they're part of the procurement that GSA is managing includes options to identify potential properties for things like that. Bed for the night location is a big consideration for the street homeless that may prefer to be in bed for the night rather than a more permanent or long-term shelter option. That's certainly what's been coming up in the casework with the homeless folks. All
Okay,
right.
thank you.
Thank you.
So this next question is from Nick Delgado, the Guam
Sure.
Daily Post. He doesn't have a microphone.
Okay.
Individuals with certain criminal records are unable to receive federal assistance. How can these individuals be assisted? And some people may have concerns with safety with these individuals. How can that be addressed?
Well, it's a big concern. It's very complicated, but I would say that the mission of the council is to provide a path for those folks that are not eligible for subsidized housing because of maybe a criminal sexual conduct or violent crime conviction or drug distribution charges. And so it is complicated. We'll be looking at the lead of some of the partners. I know Catholic Social Services has a strategy in dealing with that when they're administering the Guma San Jose facility. And there are different options that would be on the table, but there are not enough options that are available, and our job will be to try and address that as well. So yes, that is one of the target populations that is actually specified in the executive order. All right, any other questions? All right, well, ladies and gentlemen, thank you for joining us. Again, our council intends to meet on a weekly basis until further notice every Thursday at 11. If you have any written suggestions, comments, questions, you can go ahead and send them into our office. We will go ahead and send them to Rob Sanagustin, and his email address is robert.sanagustin. I'm sorry. His email address is rob.sanagustin@guam.gov. You can also call my office at 475-9380. And as soon as the OHAP office is set up, there'll be additional options to help us with this issue. So thank you very much. And council members, thank you very much for your participation. And thank you for agreeing or being voluntarily told to work on this issue. Really, truly appreciate it.